Cauley. I'm the Executive Director at Hospice of North Idaho, and I'm here to talk to you about quick tips for the Schneidmiller House, especially with facilities. So the first thing we want to talk about is how does a patient qualify for the Schneidmiller House, and what are the type of patients that the Schneidmiller House cares for? So first off, a patient has to be on hospice services and have that 6-month or less prognosis. The type of patients we care for at the Schneidmiller House, which are very different from assisted living, independent living, and skilled nursing facilities, these are patients who are either going for what is called a 5-day respite stay. And respite stays are typically accessed for patients who've been in a home setting and say their caregiver has either become ill or needs to plan a trip, or they're going to have a procedure done and they need to make sure that their loved one has 5 days to be safe. Medicare will cover that at our Schneidmiller House. So it's not typically something that you see a patient access a respite from a facility because they're already in that safe environment with caregivers. Another type of patient that would be at the Schneidmiller House is a patient who has really high symptom burden. So say they have complex pain management, nausea or vomiting, where they're requiring either IV medication or complex medication titration that can't be done in a normal setting. So say that this patient needs a nurse to be rounding on them every 30 minutes or need a provider available to make changes right away. That is an example of a patient that we would care for at the Schneidmiller House. That's high symptom burden. One misconception is sometimes from facilities, once a patient goes to the Schneidmiller House, that's where they stay. A lot of times we have patients who just need their pain management titrated. Maybe they need to be put on a long-acting medication. Maybe we need to get that straightened out because their pain's suddenly out of control. We do this all the time where a patient may get their symptoms under control and the goal is for them to return to wherever their home setting is. That can be in their home, that can be back in a facility. A part of that is to avoid, when someone has complex symptoms at end of life, especially pain, that they're not going to the hospital for that type of management. They're going to the Schneidmiller House to get their symptoms under control and then to return back to their home. One of the last type of patients that are at the Schneidmiller House are patients who may not have high symptoms, maybe their symptoms stable, but they have maybe a prognosis of 2 to 4 weeks. They're having a decline, but we're not seeing those major symptoms. This is where there can sometimes be some misconceptions that the Schneidmiller House might be a place where patients can go to live. We are not a licensed long-term care resident. Patients can't come to live at the Schneidmiller House. However, we will try to create a space for patients to come to when maybe they have a prognosis of 2 to 4 weeks. And if we have a patient in a facility where a family is requesting for a patient to go to the Schneidmiller House, typically our goal is to figure out how we can sit down with the facility and the family and our team to discuss the goals of care. And is this what needs to happen? Are there any symptom management things that can be done in the facility? Because this has been the resident you have been caring for sometimes 10 years, maybe 1 year, maybe a month, but you are where they call home. And so if we can figure out how to keep a patient in that facility setting, we want to do that. However, at the end of the day, we want to make sure what's right for the patient and the family's desires, and we want to work closely together as we do that. So thank you for talking to me about the Schneidmiller House and these quick tips. Feel free to reach out if you have any questions about clarification.